In China, 9,000 people might be dying each day from COVID-19, according to a UK health data firm. That's nearly double the estimate from a week ago. Infections have been sweeping across China as they end their zero COVID policies. The rise in cases has now caused new restrictions for travelers leaving the country and concerns a new variant could emerge.
Joining us now, Dr. Robert Murphy. He is a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning, Dan, Lauren.
We appreciate you joining us. So let's start with what is happening in China. First of all, how reliable is that information?
Well, the information, exact information coming out of China is very unreliable. This has been going on from the beginning. The official word is that everything is under control. And if you look at any of the pictures coming out of China, the hospitals are full, the emergency rooms are full. People have waited in line for 20 hours to even get into a hospital if they're sick. It's really a catastrophe, and the modeling looks really bad. There are estimates that between 1 and 3 million Chinese people will die of COVID in 2023.
I'm confused by their strategy, and I'm sure you are as well, that they had the zero COVID, zero tolerance policy. Then suddenly they opened up everything, but it seemed like there weren't a lot of effective vaccines available before they did this. Is that part of the reason why we're seeing such a high mortality rate?
Yeah, Lauren, you hit the nail on the head there. They had their lockdown policy was so effective. Hardly anybody had COVID. They had one of the lowest death rates, infection rates, and that was true, but they didn't let people leave the country. It was difficult to get in. They had lockdown after lockdown after lockdown. So hardly anybody got COVID. So there's no natural immunity. And then the vaccines, there's two problems. One is, although they have 9 approved vaccines, they're the older technology vaccines that are not nearly as effective as the ones that we have here. So they're less effective. And then people took the first 2, but then they never got boosters. The people are really, really at risk for getting infected, and that's exactly what's happening.
And walk us through the U.S. response so far.
Well, the U.S. Is following along with some of the more aggressive countries making testing prior to coming into the country policies. So Italy, Japan, South Korea, the United States, we are all requiring now that people have a test within 48 hours of getting on a plane to the United States. Some of the countries actually require testing upon arrival, India also. And this is because 2 of the first planes that left China, one to Milan and another one to India, they were tested upon arrival. 50% of the passengers were positive. Wow. I mean, that's how much is going on there. That just tells you really what the story is.
All right, Dr. Murphy, thanks so much for your time this morning. We appreciate it.
Thank you.